There are a number of barriers which face the delivery of CAR T-cell therapies for patients. Firstly, the treatment itself is expensive, and so you need to meet eligibility criteria that are predefined in order to be able to receive the treatment. Secondly, the treatments can be toxic, so you need to have a patient who's able to cope with those short-term toxicities potentially, and trying to reduce those toxicities can be important in providing the same therapy for a broader range of patients. And then finally, the way that we make our CAR T-cells can be adapted to try and create a platform for manufacture which could be rolled out across larger numbers of patients, and so that's something else that we're looking at as well. For CAR T-cell therapy on a commercial basis, NHS England will now supply Tisigen Lacusel, which is the Novartis CD19 targeted CAR T-cell product for children and young adults with BALL, but you need to have either relapsed post-transplant, to have relapsed after at least 2 lines of therapy and be refractory to those lines if you're a patient with frontline disease, or you're a patient who has relapsed and been refractory to at least 1 line of treatment. So you need to have fairly advanced disease as demonstrated by those eligibility criteria. Further, you need to have a bone marrow disease burden of at least 5% of blasts in the bone marrow, and you can't have isolated extramedullary disease. And then finally, you need to have adequate organ function and performance status to be able to tolerate the treatment, and those are the main inclusion and exclusion criteria for NHS England and therapy with CAR T-cells for ALL. In relation to the side effects, so there are 2 major categories of side effects that people worry about and were very prevalent in the US studies that had provided the pivotal data for which commercial therapy is now possible. So the first of those is cytokine release syndrome, which is a sepsis-like syndrome. It can involve multiple organs and be of variable severity, but in the American studies using Tisigen Lacusel, so that's the Eliana study, about 50% of patients had severe cytokine release syndromes, grade 3 or greater, and at that level in the US and in Europe, those 50% of patients went to ICU to have further supportive care. In general, those toxicities are short-lived and supportive care is all you need. There's also the ability to deliver a specific antidote to cytokine release syndrome, which is a blocking antibody to the IL-6 receptor called tocilizumab. And with that therapy, generally, cytokine release syndrome is manageable in a centre which is adequately trained and set up to deal with those sorts of complications in an intensive care setting if necessary. Then in relation to neurotoxicity, again, with regard to the delivery of the Novartis product, so Tisigen Lacusel, which is the Leukemia product, to young children and young adults, generally the rates of neurotoxicity are not that great, so only about 20% of patients get severe neurotoxicity, which is much less than the adult lymphoma data, for example. There's a plethora of manifestations, and it can be quite variable between different patients how that neurotoxicity presents itself, but it's generally mild and short-lived. A small proportion of patients may get sort of obtundation, i.e. a coma, and need to go to ICU again for supportive care. And in this situation, tocilizumab therapy is probably less effective, and so steroids are the mainstay of management.